Okay, so I have Eduardo here. He is here for our discovery session today for our SoftWave tissue regeneration therapy, so our non-invasive stem cell therapy. Tell me a little bit about what's going on. It's your right hip, is that correct?
Yes.
Okay, and how long has that been going on?
For at least 3 years.
3 years, okay. And you're a ex-soccer player,
Yes.
is that correct?
Yes.
Okay. How long did you play soccer for?
20 years.
20 years, at least probably.
Yeah.
Okay, and so what do you think caused it? Just the repetitiveness of running and kicking?
Yes.
Okay, all the stuff that comes with the physical activity of soccer. Okay, let's do this because I know that you were working with Dr. Kaylee on this, but some of the wider stance squat positioning is really hard for you to do, and that's when it really starts to elicit some of that pain. Is that correct?
I mean, it's not really, the pain kind of go,
Comes and goes. Yeah.
Like I said, yeah, when I squat, I can feel pressure, not pain, pressure.
Okay. What's the most uncomfortable thing about this for you? What does it limit you from, or is there anything that's it's causing you not to be able to do?
Basically, yes, it's a pain that, like I said, comes and goes, kind of bothers
Yeah.
you.
It's kind of like a pain in the butt.
Yeah, correct.
Awesome. So let's do this. Let's get into a little bit more of a shoulder wide stance. And yep, and then we're just going to kind of go down into a self squat. How far can you go? Okay. We can go about 90 degrees there. Okay. Do you feel it give you a little bit more uncomfortable? Okay. Go ahead and go down into it again. And I'm just going to kind of hold and stabilize. Yep. Okay. And come on up. Yeah, so I can feel a little bit of weakness there into that acetabular joint. What I want you to do is sit on the edge of the table here. And perfect. Without any stabilization, bring that left leg up. Okay, no problems there. Okay, bring this right one up. Anything there? Okay. What I'm going to have you do, we're going to get started here. I'm going to focus in on that right hip. We're going to do the right posterior joint here and then into that right acetabular joint. I'm going to have you go ahead and stand on up. Go ahead and stand on up here. I'm going to have you take your glasses off. You can set those right on top of here. When you lay face down, you can place your arms wherever they're comfortable. And then what I'm going to do is I'm going to prep you here so that way we can get started with the treatment. Now, SoftWave is non-invasive stem cell. Okay? And so what I mean by that, there's no injections. There's no, with stem cell, there's been a lot of, conversation about the efficacy of it. This is all your natural stem cells that are already in your body. So we're using a hydroelectronic charge to draw the healthy stem cells from your body down into the area of damaged tissue, okay? So for you specifically, it's into this right lower back, right hip, okay? So we're gonna pull these down here a little bit so we can access this right hip, right into there, and right through here, okay? So we're gonna map this whole area. But what I need to know from you during this whole treatment is just on a scale of 1 to 10, how you're feeling when we're over certain areas. If it's really low, we're not gonna focus much time there. But if it's really intense, that's where we wanna focus our time because that's where the most damage built up is, okay? So we're trying to get rid of that. I'm gonna put some ultrasound gel on you here. Good. Okay. All right. So you're going to hear some loud clicking. That's just going to allow us to be able to get into the deeper grooves here of where we want this to focus on. So we're going to go ahead and get started. Any questions so far?
No.
Okay. We're going to go ahead and I'm going to turn this down just a little bit. All right, 0 to 10. How does that feel right there? Okay. Anything here? Anything up in here?
No.
Anything right over the sacrum area yet?
No.
Okay, good. How about into this area here?
No.
Nothing there yet? How are we doing there? There? Does it track down with you here? Or not too much? Okay. You said right into there, huh? How about as we get into the middle here, anything up into here? I'm gonna move this leg, separate that, open that joint space up a little bit there. How are we doing there?